Hello, everyone. Welcome to Arash's World. Today we have a special guest, Dr. Laura Dabney. How are you doing today?
I'm great. Thank you. Thank you for having me.
Oh, for sure. Now, the first question is a bit tough, but then we're going to ease into it. And how would you briefly describe yourself to our audience here? What would you say?
Well, I've been someone who's always been fascinated by why people do what they do, people's behaviors. And I was very fortunate to be able to um, find out how to do that and get paid for it. So I spent my life figuring out ways to go into behavioral health and learned that medicine was the best way. And here I am as a psychiatrist. And then I really bucked the trend because I ended up being someone who did psychotherapy as opposed to medication management. So.
Very interesting, and I'd like to talk about that shift too a bit later. But your book is I Need You, Now Go Away, Reclaiming Your Life When Someone You Love Has a Personality Disorder. So it's a long title, and what is it about? I mean, you do explain some of the things, but personality disorder, and let's talk about that here.
Well, I wanted to change the narrative that I'd been hearing a lot. I didn't agree with it. I really believe that people with personality disorders are not a certain type of person. People with, these aren't certain types of people. These are people
Mhm,
who have dealing with a certain conflict. And that
mhm,
conflict is a almost a phobic reaction to both closeness and distancing. And so they handle this conflict in different ways. And that's the different type of personality disorders we see. Some handle it with haughtiness and drama. We've heard a lot about that. But others that a lot of people don't hear about deal with it through withdrawing or helplessness.
exactly. But you also look at relationships. And so that's kind of interesting because then you have two parties who are involved and both of them are suffering in that relationship because the person who has a personality disorder and often the other person who is living with the person who has it. And so this is a bit complex. And how can we deal with that? Maybe also from the person who is suffering with being someone or loving someone who has a personality disorder.
Well, just to be clear on that point,
Mhm.
actually, a lot of personality disorder people meet up with other personality disorder people.
Mhm.
Okay, so it can be both, and that gets a
Yeah.
little even trickier. But if you're with someone who has a personality disorder, the key piece is that you can make a change to help that person. A lot of
Mhm.
people get stuck with the personality disorder person has to change to fix the relationship.
Mhm.
And if I suggest that no, you actually can make a change which changes the pattern that the personality disorder person is causing, then they have no choice but to change because you've changed the pattern. Now,
Mhm.
some people get offended by that. They hear that as, well, I'm the problem. But it's really to empower the people who are with the personality disorder people. You are not helpless. You do not have to wait to change your partner, which we all know doesn't work. You can make a change.
But that can be difficult. And again, I'm talking also partly about personal experience there, because you do get stuck in certain patterns. You do end up being also attracted to the same kind of personality disorder, kind of in quotation marks. And it is something that often, in my experience too, goes back to childhood and the relationship with one's mother, for instance.
Absolutely. It always goes back to the relationships and the patterns that were encouraged or used in the childhood home,
Mhm.
in the childhood situation. Not only are the relational patterns copied, because remember, always the familiar always takes precedence over the novel.
Mhm.
So people slip into what's familiar all the time, and whether it's the relationship pattern or the emotional conflict that's also often a part of this personality disorder.
And ironically, the familiar is also the comfort because that's like you felt that that was your impression of love or of closeness, which is again flawed. So you start off with basically your template not being really beneficial to your own health.
Well, this is where it gets kind of tricky,
Yeah.
is because it's not just where you felt love. You can have felt a lot of pain in childhood and realize that and still pick the
Yeah,
familiar
that is true.
over
Yeah.
the novel.
Yeah,
So, yes.
yeah. So, again, maybe from the person who is again going through that as we're speaking, what would you recommend? So, how can they basically reclaim their own self? Because I think a sense of self is kind of eroded when you are in that kind of relationship. Again, I'm looking at somebody who is with someone who has a personality disorder, not both of them at the same time. So, how can you deal with that? And reclaim your own authentic self in that process.
Well, in each personality disorder, I spell out how the person who's in the
Hmm.
relationship with that person. So it's not a quick answer, but I can give an
Hmm.
example maybe
Hmm.
as a way to demonstrate. For instance, narcissists often end up with dependent personality disorders.
Hmm.
So one is the doer and
Hmm.
one is the absorber, I call it.
Hmm.
So the one who's the doer often is comes in saying they're exhausted. They keep trying to get this person to do more, take more responsibility, do things without being told. And they just keep harping on that. But if I tell them, well, stop, if you stop taking over that and don't do it, then the person who's dependent on you for direction and chores and getting things done will have no choice but to
Hmm.
figure it out. So
Hmm.
we'll work with them and say, that a couple will start talking about something. For instance, he didn't know how to do X or didn't know how to do Y. And I say, well, just ask him, how would you figure it out? How can you figure it out? So asking questions as opposed to directing is one of those changes that they can make in order to encourage the person to step out of that
Hmm.
dependency zone, as opposed to trying to push them to get out of that zone.
Yeah, yeah, it's a bit complicated, absolutely. But you don't generally, I don't know, in your experience, have you had like two narcissists being together? Because I cannot imagine that. But it'd be interesting to see what would be the dynamics in such a relationship.
Yeah, it's usually, not because they wouldn't tolerate each other. But I actually had a patient who had two narcissist parents, and they just fed
Oh
off each
my God.
other.
Okay. Yeah.
So they were able to let go for this person's narcissism, but they both missed. Of course, my patient was totally lost
Yeah, of
in
course.
their worlds. So,
Yeah. And so it's quite common. I mean, we do a lot of people are suffering from personality disorders. I think you have
y-
1 in 11 in the US is
yeah,
suffering from it.
I think it's way higher than we know because a lot of it's been so misunderstood, and only one end of the spectrum has really been focused on.
Mm.
So yes, I think it's much higher than we realize.
So the issue is more about kind of the patterns and so on. And I find it very interesting that you moving, and as you as we started off, you said you're moving from the medical model towards looking at the psychology or again psychotherapeutic ways of dealing with that. What caused you to switch in that direction, which I applaud, by the way.
Well, that's a really good question. I was, again, I was very fortunate to be in a medical school residency program. So when I'm in training after get my MD, they threw us into the first 2 years were all about emergency medicine,
Mhm.
going to the ER, learning how to hospitalize when they need to be hospitalized, then how we fix with medication. And there was some therapy done on the wards, but I wasn't involved in that. It was more the nurses and other people dealing with that. So it became very heady. I have to say, that was the direction I was going. I mean, I'd walk into the ER, doc, we need you for this, doc, we need for that. And I'd get them up on the floor. They go from being, very ill to being better pretty quickly. It's very satisfying. And then in
Mhm.
that last 2 years, they threw us into a clinic where you had to do therapy. And I thought, this is so boring. I'm sitting here in this room with this
Mhm.
person. What fun is this? No one knows who I am or what I'm doing. And I had we did all the types of therapy, CBT, psychoanalysis, da, da. So when I had my psychoanalysis professor come in and be able to say to somebody, I think you may be doing this because of this pattern you have now. You said this was the pattern that your dad did with you. And they go, oh my gosh, that moment
Yeah.
of insight, priceless.
Absolutely. I'm a huge proponent of psychoanalysis, and I think like the insights you get, it's just worth $1 million or
Yes,
more.
exactly,
And
exactly.
I had two occasions where just a lot of our fears are based on that, and again related to a narcissistic mother. But the thing is, when like I had my boss who was female, and I was like terrified of her, and then the realization that wait, this is the same pattern I had with my mother, and she's not my mother, and then the fear just like went away.
Yeah,
Just like that. It's like snapping your finger. It's like, oh my God. I mean, it does take work, and I'm not like I don't want to simplify it, but that insight is so important. And then it's your job to take it further, I think, to act upon it.
that's exactly right. I have a narcissistic mother. I was terrified of my professors in college. I got a
Yes.
bad grade on an exam. I couldn't go ask them, how can I improve?
Yes.
And it took me a long time to make that connection that you did. It's
Yeah.
like, they're not all authoritarian um, people are like my mom.
hmm But it's also again that kind of fear that we have, that we carry around, fear of abandonment, fear of being ridiculed, fear of like there's actually a really long list. And so,
Wow.
how could we approach that? Or what advice do you give? Again, this specific situation that both of us have experienced.
Well, I think first you have to understand that we had a lot of emotions towards someone we loved very much and depended on greatly.
Mhm,
And that often brings up the idea that the child takes on the role of I'm the one to blame. So
mhm.
if you have this tremendous rage
And
at
you're
your mother,
told you're the one
exactly.
responsible, right? So it's
Yeah,
not, it doesn't come out of nowhere.
yeah, exactly. Well,
Yeah.
even if you're not told directly, it's everybody's acting that way.
Yes. Yes.
So your mother's very hurt or whatever that you did something that she didn't want you to do, and they yell at you or shame you in some way, and then the child says, "Oh, my mother cannot handle my needs, my independence, whatever it is, so I have to stop doing that."
Yes.
So we go into with almost, that's why I said earlier, almost everybody with a personality disorder has conflict over their emotions. So when we get angry that the professor or the boss chastise us or, reprimanded us, not even reprimand us, but led us in a different direction, the anger comes up and
Mhm,
we can't admit it. So we don't go and say, "Hey, I don't really think it was fair that you gave me this grade." We just have to bury the anger with burying the distance from it. So it's the conflict or needing the three emotions that people are most conflicted over: anger, sadness, neediness.
mhm,
If you can't go to somebody and say, I have this emotion, then you're not really connecting with them.
mhm.
You're just trying to bury it, and that never goes well.
No, no, never. That's right. What about, I mean, a lot of people have like relationship issues and they go to basically a life coach or somebody who would help an expert in relationships, but not necessarily like yourself, a psychiatrist who knows the underpinnings of everything. So what would you say for people that who are looking instead for like, relationship advice of people who are qualified to a certain extent, but not when it comes to personality disorders, for instance?
Exactly. So, I promote this in my books, both cognitive behavioral therapy and psychoanalytic therapy, because the cognitive behavioral therapy I have to use with people right from the beginning in order to build trust. So we
hmm
talk about, and this is what life coaching really is, a lot about CBT or supportive therapy.
hmm
So we let them vent, and we talk about practical ways that they can shift from a maybe it's a defense that's not very healthy, like excessive drinking or excessive working, shifting to something that's more healthy way of avoiding something. So that shift is great, and it can give a quicker relief. But the underpinnings of the patterns that are in your relationship or the personality that you have or any unconscious conflicts, those aren't addressed by people who have not gone through psychodynamic or psychoanalytic training.
That's
So
right.
you just need to, and I talk about this in the book too, how to find that person by asking those questions.
I love the kind of holistic approach too of using different modes and to get to a certain place and starting off with CBT. I think that's a great approach
Yeah.
here. Yeah.
Well, it's very effective. And again, so we had the training of all of it, but what really bothers me, and it's very upsetting, you maybe have experienced this, is that the CBT people trash or really say that it's worthless, that psychodynamic and psychoanalytic training is worthless
They're
because,
slightly changing a little bit,
are
right?
they?
But it's
Okay.
too
I
slow in
haven't.
my view, right? They accept the unconscious, but I mean it's still like no, there's way more to go there.
Well, yeah, they might accept it, but they don't, they keep saying, well, it's not been proven.
Yes,
It's not,
you're right.
so they push it aside instead of realizing why wouldn't we use everything that we can to help people,
Yeah.
every mode of treatment that can help people. It's very, in fact, my book didn't get published by one publisher was initially interested only because I had psychoanalytic ideas in there.
Oh my God. Yeah.
So.
Well, yeah. How can we tell though if it's a relationship stress that is quote unquote normal, that is kind of like not related to like a disorder? How can we see the difference? Like when and that would help people to choose, okay, I do need to see you, or I can just talk to a coach.
It's a really good question, and it's paramount to helping people tease out what is, normal relationship stress, for lack of a better phrase.
Mhm, mhm,
But people who have, of course, people argue and have problems in a healthy relationship. The key is, can you eventually, at some point, come back to the discussion, come back to the conflict, and resolve it? You may not be able to resolve everything first go or second go, but does it get resolved in a way that you're both being genuine or open? Of course, I talk about the being able to talk about your emotion to get that off your chest and have the other person understand you. And does the other person do the same? If you get into if you're in any kind of a situation where you use destructive aggression or destructive passivity, or your partner does, it's going to be a problem and probably need more help. Destructive aggression is when somebody pushes you to, this is the facts and I'm right. You've got to admit, giving this, very destructive, trying to push you or force you into a decision. Or if there's a person who won't say what they really feel or think and expect you to just know,
mhm,
that's destructive passivity. In those two cases, that's not something you're just going to overcome. That's something that needs some attention.
mhm. So that's not just like being shy or anything in that kind of example. That's going further than that. There's something underlying there as well.
Right. Well, whether someone labels it as shy is not or not, but right. So sometimes people don't know what to say or they're sort of, thrown by this conversation. But someone who's not shy or someone who's shy will maybe come back to the conversation and go, look, I was a little thrown by what you said, and I didn't get a chance to say what I really felt, and this is what I feel. That's why I was saying, it might take a couple times to resolve something, but um, people who are in a healthy relationship and are comfortable with their emotions will be able to do that.
And I'd like to know more about communication. So a healthy type of communication, what would that look like? Because we looked at some of the negative sides, and I know like walking on eggshells, it's always like there's certain things you cannot bring up, you shouldn't say this, and so on. But I want to know the positive, healthy way of for a sort of communication between people.
I have this little problem with the whole
Mhm.
better communication, because
Yeah.
there's two steps that have to happen before you get to the communication.
Hmm.
So people start speaking better, or I'm not sure how to say that, is communicating better, but the problem isn't resolved because first that goes back to the emotional conflict.
Hmm.
It's not the emotion that's the problem. It's not the communication that's the problem. It's the conflict over having the emotion that's the problem. So people can't even bring it up in their own head.
Hmm.
Anger is a great example of that.
Hmm.
People feel so guilty about being angry at someone they love that they will just bury it. They won't even make it conscious. And if you're not conscious of an emotion, you're certainly not going to be able to communicate that well. So that has to be the first step to be able to what I always call sit with or roll around in whatever emotion it is that you have. And then you have to think about this, right? You have to think about, okay, so what is the best way to handle this? sometimes communicating it isn't the best idea. Sometimes you want to keep it to yourself and maybe not communicate that, figure it out, figure out a different
Mhm.
way, vent. Like you're not going to tell your boss, you're angry at him or her for whatever. You're not going to start crying to your boss about some problem you're having at home. You may have to sit with it, find a different way, find someone else to vent to, find some other way to ameliorate that symptom, that feeling.
That's great advice because people think also being yourself is you say everything that comes to your head, and that is not being yourself. Right? That is just being spontaneous, which is not always good advice there. Yeah.
Yeah. It's very important to be able to first be comfortable with all of your emotions, all of them. It's it's uncanny how many people I'll have not be able to. One of my favorite questions when I'm seeing someone the first time is, well, so how do you handle your neediness? I'm not needy.
Yeah, yeah, exactly.
But then I know
What
I'm
kind of
needy.
question is that? Yeah.
Yeah, right. I'm not needy. What makes you think I'm needy? I'm the one who gives to everybody. I'm the
Or
one who
or
gives
how do you
back.
know? They would ask you, right?
Yeah, right, right. I
Yeah.
didn't ask right. So when I ask about the emotions and how they deal with it, it's a really a telltale sign of where the problem is.
hmm I'm just started watching Beef, the program on
Oh
Netflix,
yeah,
and it starts off with like every relationship needs to have conflict and anger. And is that true?
it is so true. Well, I say a lot, and I know a lot of therapists say this. Whenever a couple comes in and says, "Oh," or someone tells me, "We never argue. We've never had an argument," we cringe. Like, oh no, there's a huge ball of something
So
unpleasant
then there's
underneath it.
something wrong if you never argue, basically, is the
There is
message here.
something wrong. We never argue. Now you
That's
may
interesting.
not, I mean, then there's the opposite with people who argue about everything, and
Oh yeah. Yeah.
then that's a problem as well in a different direction. But y- you're going to have some conflict, and to have a little heat behind it isn't unusual at all. And again, it gets off your chest. And we also have ways of, if that healthy people know they can either preemptively or we call it post-mortem go back to the conversation. So many people who have relationship problems are so afraid of the argument that they don't ever resolve it. They never go back to it.
Mhm.
So going back and saying, look, I blew up there. I think I was more stressed than I realized. I apologize. I'd like to have another try this again. Would you be willing to talk to me again about it? It
But that
almost
is so important to apologize. And when you are with a narcissistic person, that does not happen, right? And I think
well,
that's when you open up, become vulnerable, and then you see the other person as a human being, not as this like this person that, you have difficulty with.
exactly. And that's exactly why some of the personality disorder people can't get to resolution because it they're protecting something else. They're protecting they have this push-pull pattern, they're protecting that closeness and distancing. They're trying to be in that middle zone that doesn't really exist, but they try to stay there. So going to someone and saying, I apologize, I want to try again is a form of opening up, and it's a form of
Yes.
closeness. So
Yeah,
they can't do that. They might say something along the lines of, well, we'll try it your way this time, as a way. They might get that
exactly.
far, but
Yeah. But something that's very hard to do, especially again, somebody who's been in those kind of relationships, like myself, is setting boundaries. But I think that is so important. And before I used to see setting boundaries as like kind of protection against the other person, but now I see it as like protecting my own space. So it's really like for myself, not related to the other person, to have healthy boundaries.
exactly. And how you set the boundaries is very important.
Mhm.
And you're reframing it like that, where you're protecting yourself by able to say that. So we always talk about in my practice setting a boundary with a bridge statement. So if you have to say, look, I'm so sorry, this is upsetting me, this conversation, I have to stop
Mhm.
and you have to leave. So you're not telling the other person, right? You're taking
Mhm.
full control over taking care of yourself and full responsibility for your feelings. And then you say a bridge statement, but I will see you at dinner and maybe we can try again. Because
Mhm.
if you just leave, people will say, oh, it's a boundary. I have to go. I'm out of here.
Yeah,
You're being mean, whatever. Then it comes across as you're rejecting or criticizing the
mhm.
person as opposed to setting a boundary for yourself.
Mhm. And when you're in a heated discussion, you can't think clearly. I mean, the
Yeah.
logic does not work at the time, so you can't find solutions. And I think that's a great way of like bringing down the temperature and then coming back, but with again a calmness that can help the communication.
And there's also a preemptive, we call it preemptive strike here, where if you know a conversation historically brings up a lot of negative feelings for either you or the partner, you can start with that. People always say, "Oh, I'm so afraid to have this." Well, tell them that. So if you start with, "Look, I have to tell you something, but I'm kind of anxious because historically, whenever we talk about going to visit your parents, it ends up in an argument. So I really would like to try to have this conversation without arguing." That almost always person gets steps in. Now you're together agreeing to not argue, and that can
Yes.
be wonderfully helpful.
Yeah, yeah, absolutely. And so, what about people who are very successful? They're in their business and in their life and so on. And then in the personal life, that's not the case, right? So it seems like you have to choose one or the other, and but you can have both, right?
Yeah, so you definitely can have both, but you just have to realize they're two different things, and that's what ends
Right.
up happening. I've treated a lot of very successful people, and they get home and they're like, "Why doesn't this work at home?" Well,
Mhm.
at work we have structure, and you're being compensated, so they can. It's easier to tolerate being told what to do and having to follow a certain pattern. And if something is a problem, they just go to the SOP and read it out and do it. So the boss or high powered person thinks that's a good relationship because they're reading his mind or doing what he wants or she wants. But at home, it's voluntary. There's no compensation. So those same kind of patterns can come across as controlling.
Mhm. And also, I want to talk here finally about you're the founder of Relationship RX. Can you tell us about that?
So I've realized in the 26 years I've been doing this that sometimes people just need a direction. I had one person who came in, had a disagreement with his son, and his son believed that he did something to the mother when they got divorced, that this patient who was seeing me never did. And they just couldn't, they couldn't, they were each trying to get the other one to believe what they believed. And so he was missed 5 years of this being with his son and the son's child, so his grandchild. And he was desperate to get how can I get the son to believe me that I did not do this? I said, well, what if you just agreed to disagree
Yeah,
and
yeah,
didn't even go there?
yeah.
And that was it. He said that was fantastic. He was going to try it. He did it. He wrote me that they agreed to do that and they continued their relationship. My point being that sometimes people don't need therapy or even want it. And that keeps them from going to get this kind of help. So I call it being a relationship consultant, where I put all of my articles, podcasts, blogs, everything I've ever put, in writing on Relationship RX. So people can just go and get help without necessarily going into therapy or just consult me for a few times to get some direction.
And sometimes the answer is simple, and you
Yeah,
don't because people have the impression I need years of therapy. You might only need 5 or 10 minutes.
exactly. That's exactly right. But a lot of people don't know that. So we're getting the message out that sometimes it's just a different viewpoint is
Yes.
all it takes sometimes.
Absolutely. Wonderful. Thank you so much. So, Dr. Laura Dabney, you are a psychiatrist, relationship expert, founder of Relationship RX, and your book is I Need You Now Go Away, Reclaiming Your Life When Someone You Love Has a Personality Disorder. Such a pleasure talking to you. Thank you so much.
Thank you very much.